interest in health equity in his free time, and he does freelance journalism too. It's my privilege to welcome Dr. Gabriel Stephen. Next, I would like to introduce Mr. Manish Patel. He holds his master's in clinical microbiology, and he's certified in infection prevention and control. Manish is currently working as a certified infection control practitioner with the Niagara Health at St. Catherine's General Hospital. It's my pleasure to welcome Mr. Manish Patel. Next, I would like to welcome Mr. Manoj Edamana. Manoj is a registered social worker, and he holds a master's degree in social work from India. He also did his diploma in counseling from UK. Manoj has many years of professional experience with various agencies in UK and in Canada. So for the last 8 years, he has been with the Niagara Health System as a social worker cum therapist. Manoj is also the current president of NMA, and he also associates with other associations in North America. So it's my pleasure to welcome Manoj Edamana. So finally, no seminar is successful without active participants like all of you. It's my honor to welcome each and everyone to this meeting. So this will be a 1-hour seminar. So the first 30 minutes are for the presenters, and after that, we will have a question and answer session. So please participate by asking questions in the chat box, or you can directly by unmuting yourself. Now the presenters can take over the floor, and we'll start with Mr. Manoj Edamana. Mr. Manoj.
Great, and thank you very much, Millie, for the wonderful introduction. And it's my pleasure to share some of my knowledge with our community. And it's a great opportunity, and it's the best apt time to discuss about COVID and different vaccines. So my goal is to provide a brief idea and detail about the COVID, the origin and etymology, and how it affects our community. So let's start with what is COVID-19. So coronavirus are a group of viruses that can cause disease in both animals and humans. The severe acute respiratory syndromes called SARS, new virus strain known as SARS or CoV-2, or novel coronavirus 2 or 2019 nCoV. The virus causes, not really. Sorry. Sorry, just for 1 second. Can you see? Yeah, I can see. It's unmuted. Sorry about the technical issues. The virus causes coronavirus disease 19, in short, COVID-19. And CO stands for corona, VI for virus, and D for disease. The name coronavirus is derived from Latin word corona, meaning crown or wreath. And of course, it is coming from the appearance of the virus. It looks like almost like a virus, crown, and that's why it's called corona. There is a story behind, or there is a discussion behind the name. So the World Health Organization named novel coronavirus or COVID-19 without having stigma to any region or race. In the past, there is a virus called Middle Eastern respiratory syndrome, and that name caused a lot of stigma to Middle Eastern people. And the other example is swine fever or swine flu. And because of the name, a lot of pig farmers had to give up their job because there's a lot of negative stigma attached to them. So they had to change the name to H1N1. So here, World Health Organization developed this name as a coronavirus without attaching to any race or a region. On March 11th, 2020, the World Health Organization declared COVID-19 as a pandemic, and a pandemic occurs when a disease that people are not immune to spreads across large regions. And theories of origin of COVID-19. There is a lot of political discussion going on. I'm not going deep into that one. But many health experts believe that the new strain of coronavirus likely originated in bats or pangolins. The first transmission of humans was in Wuhan, in China. Since then, the virus has mostly spread through person-to-person contact. However, it remains unclear exactly how the virus first spread to humans. The new variants of COVID-19 has been reported in UK, South Africa, and now in Canada as well. The fact is that all the virus gets transformed over period as in line with Darwin's theory. Some of the symptoms of COVID is listed by CDC. So common symptoms are fever, dry cough, and tiredness. Less common symptoms, aches and pains, sore throat, diarrhea, conjunctivitis, headache, loss of taste or smell, a rash on skin, a discoloration of fingers or toes. Dr. Mary Loth in her article describes or groups corona into 5 groups: asymptomatic, mild, moderate, severe, and critical. And I'm sure that Dr. Gabriel will look into this area in detail. Around 80% of people with COVID-19 recover without specialist treatment. These people may experience mild flu-like symptoms. However, 1 in 6 people may experience severe symptoms such as trouble breathing. However, it can cause symptoms that become severe, leading to death in some cases. COVID and quality of life. The pandemic has had unprecedented impacts on the quality of life of Canadians, who have reported their lowest levels of life satisfaction since data became available in 2003. That's the time SARS started. The shares of Canadians rating their life satisfaction decreased from 72% in 2018 to 40% in June 2020. Youth and immigrants experienced largest declines in life satisfaction since the start of the pandemic. Before the pandemic, life satisfaction was generally similar among immigrants and the Canadian born. Excess mortality, the number of deaths in Canada was higher than expected during this time. It can be related to COVID and comorbidity as well. Social impact. The social impacts have also been uneven. Great impacts on these population groups with pre-existing vulnerabilities. Immigrants and visible minorities are overrepresented among frontline workers, putting them at the putting them at greater risk from COVID-19. Social isolation due to COVID has heightened the risk of family violence. Visible minority respondents were 3 times more likely than other participants to report a perceived increase in the frequency of harassment or attacks based on race, ethnicity, or skin color. Victim services reported an increase in the number of victims of domestic abuse over this period. Economic impact. The economic impacts of COVID-19 have been uneven across the population groups. Visible minorities are severe implications for transportation and tourism. The transportation system, transport equipment operators, and warehousing sectors are the largest occupational group in the country, roughly 1 million Canadians. Many of these jobs are at risk as the movement of people and goods dwindles. About half of all the employment generated through tourism is in accommodation and food services, and the jobs were down to 55% in June comparing to pre-pandemic level. Declines in labor market. Employment losses total 3 million from February to April, almost 2 million of which were in full-time work. Employment rose by 1.9 million from April to August. Total employment in August was 5.3% below its pre-pandemic level. Without government transfers, financially vulnerable families would have needed an average $3,500 over 2 months to stay above low income. So without that support, it was impossible for lots of Canadians or immigrants to survive. 1 in 3 Canadians did not have enough savings to handle a 3-month work stoppage. Business closures. So it is doubled to 88,000 in April, and in May it increased to 62,600. That is 29% less than in April, but still 59% higher than pre-COVID-19 levels observed in February. Mental and physical health impact. The pandemic has impacted the mental health of Canadians, with youth experiencing the greatest declines. Since COVID-19, fewer Canadians report having excellent or very good mental health. 55% in July 2020, down from 68% 2019. Mental health outcomes differ across visible minority groups, who are more likely to report poor mental health and impacts on ability to meet financial obligations. Visible minority groups were also more likely to report that the pandemic has had a moderate or major impact on their ability to meet their financial obligations compared with whites. And here is the ratio. South Asian, 44%, Black, 38%, Filipino, 36%. Those reporting poor mental health are up to 4 times more likely to report increased substance use since the pandemic began. Prior to COVID, an increase in cannabis use highest among youth aged 15 to 35, that's 12%. Increase in alcohol use highest among those 35 to 54%. Similar patterns between males and females observed. Statistics as of 29th of January 2021. Global level, the total confirmed patients, COVID-19 patients, 102,044,576, while death is 22,006,091. For the USA, 924,374, and death 436,634. And Canada, it is 770,793 confirmed cases, and death is 19,801. And in Ontario, confirmed cases 264,300, and death 6,072. Niagara, confirmed cases 7,743, and death 307. These statistics as of yesterday. And of course, it might have gone up a little bit today. And here is a ray of hope. So the ray of hope is coming from vaccinations, and that is here now. And some of the vaccinations identified: Moderna, Pfizer, BioNTech, Covaxin, and Covishield, AstraZeneca, Novavax, Johnson & Johnson, and so on. It is a fact that we are going through one of the most difficult times of the modern world. The new situation created a new norm and a new way of life. It is not sure how long this situation will continue, but it is quite encouraging to see the graph of infection spreading is coming down, and vaccines are being administered, and people are eagerly waiting for their turn. According to Troy Day, it is going to be a race. If it spreads quickly, then it is going to be difficult for us to feel comfortable opening up. If it spreads slowly and we can do vaccinations quickly, then we are going to be in much better shape. A successful rollout of vaccines will improve our morale and rejuvenate our economy. The support from both provincial and federal government will help us to remain in great shape, and thanks to their forward thinking. It is sure that we will pass this time too. Stay safe and stay home. Thank you.
Thank you, Mr. Manoj, for your presentation. It was very informative. Next, I would like to invite Dr. Gabriel Stephen with his presentation.
Hi, everyone. I'm just going to try and screen share. One second. It's just not letting me share the screen. I think the host just needs to enable me privileges to share. Perfect. Okay. All right, excellent. Hi, nice to meet everyone. My name is Gabriel. So I work as an emergency doctor, and it's really exciting and an honor to present to everyone today. I can speak Malayalam. So question period varumba, if you have any questions in Malayalam, feel free to ask it in Malayalam. More than happy to answer. My big goal here is to make this information accessible to everyone, and I'm excited to have some meaningful discussions. So I'm mostly going to be talking about the vaccine specifically, and then combating some misconceptions about the vaccine, and then we can talk more at the actual question and answer period. So I don't have any financial disclosures. So I know there's lots of worry nowadays about, doctors getting paid by big pharmaceutical companies or all these other things. Nobody pays me other than my job. I'm just here looking to spread good information. So I'm not going to repeat a lot of what Manoj Uncle has already said. So coronaviruses are very common. Actually, a lot of viruses that cause the common cold are coronaviruses. And like Manoj Uncle pointed out, with coronavirus, we talk about this little crown-looking projections that come off of the virus, which is characteristic of it. And not all coronaviruses are mild, like Manoj Uncle pointed out. We've had SARS in the 2000s, and then we've also had this MERS coronavirus pandemic prior to that through Middle East respiratory illness. So the one that we're facing right now also is not a mild version of coronavirus, and it's spread primarily through respiratory and airborne transmission, which Manish Uncle will get into in terms of preventing this spread. I want to talk very quickly about, one of the biggest questions I get asked is about how deadly is coronavirus. And so, this is a difficult question to answer because when we look at the data, we see that coronavirus, how deadly it is changes depending on actually where you live. So one of the measures that we take on is something called the case fatality rate, which is the amount of deaths from the disease divided by the total cases of the disease. And we see that in Canada, the case fatality rate's as high as 2.5%. It's different depending on which country you look at. Mexico has a very high case fatality rate. And the reason I bring this up is not because the virus is inherently this deadly. It's actually probably not this deadly inherently. It's because how much the virus impacts the country depends so much on the resources that the country has in terms of combating the virus. And so this is where we see such variations depending on how overwhelmed certain resources are. So if a country runs out of ventilators, you may have a much higher case fatality rate in people that acquire severe COVID-19. We also know that the case fatality rate changes depending on how many people are tested in a country. So if a country only tests, 10 people, and those 10 people, 3 of them happen to have severe cases and die from it, then you would say that 30% is the case fatality rate. So it's a number that changes as well in terms of how many people are tested. So it's a challenging question to answer. But the point I'm trying to make is this is where measures like lockdowns become necessary in countries where resources are starting to become overwhelmed. And what's good news is now, in my ICU 3 weeks ago, we were completely full in terms of our ICU. I was transferring out COVID patients on ventilators to Burlington, to Niagara, because I didn't have any space in Mississauga. I didn't have space in Toronto either. And so lockdowns were implemented, and now we are seeing more capacity in our hospitals. So that's a good thing. But that's sort of the reason why this whole lockdown kind of is a measure that we sometimes implement. There's lots of harms to lockdown, but this is the reasoning behind why it's sometimes necessary. So very quickly, in terms of treatment, there's no good treatment unless you're in hospital requiring oxygen. It's mostly supportive management because, like Manoj Uncle said, a lot of people who get COVID-19, 80% of people don't require any hospital interventions. They recover with time. This doesn't include, however, there are some people that may have symptoms for months and months and months. There's this long haul phenomenon we're seeing in some patients that continue to have some symptoms for several months after the virus. But for the most part, there's no good treatments. When you're in hospital, there are treatments that we have that have some evidence, which we don't have to get into now. You can ask in question period if you're curious. But that's sort of where we're at with the virus. So to talk about vaccines, I want to give in several ways, I'm going to explain to you how vaccines work, right? And so, one way to look at how vaccines work is to think of vaccines as something that trains your immune system. So immune system or a gym, it's like a gym for your immune system, basically. So essentially, when you get the coronavirus infection, your body naturally produces antibodies and immune cells that protect you from getting the infection in the future. How good that protection is, we don't actually know. We're still figuring that out, but there is some protection. That's why people who get chickenpox don't get, chickenpox as the chickenpox clinical entity later in their life again. They might get, something like shingles, which is more of a localized reaction because your immune system does have an ability to fight it after it's seen it before. Vaccines let you do this for your immune system without ever getting coronavirus. And that's important. There's lots of different types of vaccines. The thing that a lot of people are focused on is this mRNA vaccine, both because the two approved Canadian vaccines are Pfizer and Moderna, and also because mRNA is it's the first time we've used an mRNA vaccine. So we'll talk about that. And then there are other vaccines that use different technology. But basically, the basic principle of all of this technology is that we know that coronavirus is called corona because there's a crown, right? These little proteins that stick outside from the coronavirus. What the vaccine is it's basically teaching your immune system to recognize the specific crown on top of the coronavirus. So that if you see the coronavirus, your body is able to say, oh, I've seen this crown before. I'm going to attack this and make sure it doesn't cause infection. So the different vaccines that we have just uses different tools to teach your body what this crown actually is. And all of these vaccines target the same crown, the spike protein, we call it, on top of the coronavirus, okay? And, if you have any questions about this, we can talk more about how this actually works at the end. So this is just a very quick video that explains this also.
How would COVID vaccines work in your body? Well, I have 60 seconds to tell you 3 things you should know. Ready? Number 1, getting the immune system in shape. A vaccine is basically a training session for the immune system. Vaccines teach the immune system to look for the key features of a virus. So when a virus does show up, it's ready to fight it off. Number 2, vaccine, meet virus. The vaccine gives your body a plan to recognize the virus. Then your immune system starts preparing by making antibodies, or fighter cells, that stay in your blood as protection in case the virus tries to invade. What this means is you get immunity against the disease without having to get sick first. Number 3, immunity. When enough people's bodies know how to fight off a virus, it has nowhere to go. That slows the spread. When people get a vaccine, we're able to stop the spread quicker and get a little closer to ending this pandemic. That's basically how vaccines work. And that is 60 seconds.
Good. Sorry. Okay. So മലയാളത്തിൽ ഞാൻ പെട്ടെന്ന് പറയാം. So എലിയും പൂച്ചയും. So this is the analogy I want to use. So നാട്ടിൽ we have this issue with Eli, right? So whenever I go to Amachi's house, we have sometimes we have some problems with Eli. So the problem is, if you have a mouse that's coming into your house all the time, it causes a lot of problems. It's really, it's bad for your food. It destroys lots of things. Tables are knocked over. All these problems are happening. So നാട്ടിലെ ഇത് ഒത്തിരി എലി പ്രശ്നം ഉണ്ടെങ്കിൽ one of the things that my Amachi got is she has cats, right? My Amachi actually had like 6 cats. She had so many cats. പൂച്ച നാട്ടിൽ പോയ പൂച്ച എവിടെ നോക്കിയാലും പൂച്ചയാ. She basically told me that it's because she has this issue with mice before, and now the pucha gets rid of the mice. So that's the whole reason why she has all of these cats, right? It's because she saw the mice, she didn't like the mice, so she created cats. So what happens though if you have a cat and the cat has never seen mouse before? How is the cat supposed to know that it has to chase mice? One way we can do that is actually give the cat a toy mouse, right? Puchakku oru toy ellie kodunda. Basically, the pucha knows, I know what a rat or an ellie looks like now, so it can chase after it. It's the same thing in your body. So your immune system has never seen coronavirus before. Our human body is not evolved to see coronavirus. So we give it a vaccine that introduces a not harmful version of a particle that basically teaches your body how to fight coronavirus without actually getting the virus, right? And so these are our vaccines. So we have Pfizer and we have Moderna. They both use this mRNA technology, which is basically just a little script that doesn't join into your genetic material or anything like that. It doesn't become part of you. It's just a script that says, this is the instructions for recognizing the crown protein on top of the coronavirus. That's it. It's not the virus. It doesn't cause the virus. None of that happens. It's 2 vaccinations separated by 3 weeks. Anyone over the age of 16 can get this vaccine. The only people that we suggest avoid it is people that have had very severe allergic reactions to some of the vaccine ingredients. Now, the risk of actually a serious allergic reaction with this vaccine is very low. And with the Pfizer vaccine, it's 11 people out of 1 million people had a severe anaphylaxis reaction to this vaccine. 11 people out of 1 million, right? And we suspect that it's because of an allergic reaction to something called PEG or polysorbate, which is in it. The vaccine doesn't have mercury, vaccine doesn't have arsenic, doesn't have lead, doesn't have any of these things that everyone's worried about. It's a fat layer that has some genetic material inside, and that's it. That's all it's in the vaccine, okay? You also shouldn't get the vaccine if you have symptoms of COVID. So the Randa vaccine that we have is the COVID vaccine from Pfizer and Moderna. Those are the 2 that we have. They're both very, very, very effective. You know, I know that a lot of people have reservations and fears about getting a vaccine. I think that's actually important. I think it's important that people question science. It's important that people think critically about things. But I'm telling you that when I talk to my physician friends and when I talk to other physicians, we are climbing over each other trying to get this vaccine. There are physicians that live in rural parts of Ontario that are begging the government to get this vaccine. For a vaccine to be considered effective in clinical trials, we're saying that a vaccine should be more than 50% effective compared to a not having vaccine in order to prevent a virus from happening. These 2 vaccines are tremendously effective. So physicians have read the papers and they have said, this is so good. 95% to 94% effective is unheard of. The flu vaccine on a good year is between 40 to 60% effective. So we are very excited, and this is a true possible way out of this pandemic, right? And so that's the comparison between the 2. They're both effective vaccines. The Moderna vaccine you separate by 4 weeks. The other big difference is the storage between the 2 vaccines. So the Pfizer vaccine, many people have heard, is a more challenging vaccine to store. You have to store it in very industrial freezers. It's harder to get. Moderna is a bit easier to store, but we have both on the market now in Canada, which is very, very good. So if you're pregnant or if you're breastfeeding, should you get the vaccine? So the reason that this is a special consideration is because when they did the safety studies for this vaccine, both Pfizer and Moderna, they didn't include pregnant people and they didn't include people that were breastfeeding, okay? So, you know, some people are worried. They're saying, oh, well, if they don't know it's safe, then maybe I shouldn't get it. The reality is we don't have the data to say it's 100% safe, but we can say that the likelihood of this actually being an issue is probably low based off of our theoretical understanding, based off of how we understand this vaccine to work. We think it's low and safe enough that, in fact, the College of Obstetrics and Gynecology, both in the US and the States and the CDC, say that if a pregnant patient wants to get the vaccine, they can basically understand that there's not a lot of safety data, but it's still reasonable for them to get it, okay? Now, this is changing a little bit. So just 2 days ago, the WHO released guidance saying that pregnant patients maybe shouldn't get the vaccine. This is still very debated. So the WHO released this guidelines, and a lot of people were kind of surprised about it. The CDC, though, still recommends that you can get the vaccine if you're pregnant. In Canada, if you're pregnant, you can totally get the vaccine. Many of my physician colleagues who are pregnant have also gotten the vaccine. So it's not an unreasonable decision, but you do have to understand the risks, okay? What about if you have a low immune system? So, you have immune disorder, you're taking medications that lowers your immune system, should you get the vaccine? Same thing, we haven't actually included these people in the studies for Pfizer and Moderna and any of the vaccine trials. And so we don't have the safety data. But the issue here is not so much the same as with pregnant people, is that it's not an issue of safety as much as it is an issue of maybe the vaccine might not be as effective. That's what we think is more of an issue if you're taking immune modulating or immune changing drugs, is that because your immune system is not able to mount a response the same way a healthy immune system can, it's possible that the vaccine may not be the 95% effectiveness that it is for other people. That's more the issue that you need to consider. Again, weigh the risks and benefits, talk to your doctor, but it's not like you can't get the vaccine. Many people who have different immune disorders have gotten the vaccine that I know also. Main side effects of the shot is usually pain at the site. And then basically sometimes people can get some chills and tiredness, usually lasts for 24 hours. You can treat it with Advil and it goes away. Those are the main side effects. You will hear all kinds of side effects come up in press reports. So I'm sure you've read, press reports saying that there's major allergy to the COVID vaccine. You might have seen a press report that says someone got the vaccine and the next day they died, right? These are very important that you think about these issues critically. Anytime a vaccine comes onto the market, when we're releasing this vaccine, we're vaccinating 10 million people, right? When you vaccinate 10 million people, the statistics are that in any given day of 10 million people, one of those people may suddenly die, right? Because they're getting the vaccine, we're often associating the fact that they died with the fact that they got the vaccine, but that's not necessarily always the case. It's very hard to make that conclusion. This is one of the reasons why for a while people were worried that the measles vaccine caused autism, because autism is usually diagnosed at 18 months, which is around the time that you get the measles, mumps, and rubella vaccine. So people were getting the vaccine and then they would say, oh, my kid was diagnosed with autism, 2-3 weeks later, and they would make this association with the vaccine causing autism. But you have to be really skeptical reading this. As far as the risk of allergy is concerned, the risk of allergic reaction to this that's deadly is incredibly low. 225 per million people are injured every year by toilets. Every year. The reality is there is risk to everything that we do in life, right? We have good studies to suggest that these vaccines are in fact safe, but you have to be careful reading the things that you read on WhatsApp or the things that you read on different news articles, because the way that you frame the data can produce inaccurate messages for people, right? And we can talk about that more in question period as well. These vaccines are very effective, like I was saying. So this is the data from the actual trials. Placebo means the fake vaccine. So we take 30,000, 40,000 people and we give half of them a fake vaccine and half of them the vaccine. And we see that the chances of you getting COVID-19 is much, much lower after about 20 days. you start seeing a separation where there's a significant decreased risk of getting COVID with both the vaccines, both Moderna and the Pfizer. So they're incredibly effective vaccines. And again, what's considered effective in these vaccine trials is over 50%. So this is over and above what we ever expected these vaccines to perform. The Johnson & Johnson vaccine recently, people were worried, oh, it's only 60% effective. 60% is actually very good. 60% effective is as good as the flu vaccine every year. It's because these two vaccines are so good that we're comparing, and the bar is set so high that it makes Johnson & Johnson look maybe less effective, but it's still very effective. So some myths that COVID vaccine might change my DNA, or, it's something by Bill Gates. I heard recently someone said it was something from Bill Gates is putting like chips inside of people, and it's, going to change your genetic information. This isn't true, right? The vaccine is not entering into your DNA. It's not merging with your DNA. It's basically just a little instruction list that your cells say, oh, this is how I create proteins that identify this crown, and that's all it does. It's very safe. It doesn't change your DNA. It doesn't cause infertility. So this is one of the things that people were really concerned about, because there was a concern theoretically on social media that the vaccine might block the placenta's ability to actually cause, because placenta's ability to implant into the uterus to allow for pregnancy to happen. There's no evidence that this is the case, and 23 people in the Pfizer trial became pregnant. COVID-19, though, is linked to infertility. COVID-19 can cause something called orchitis, which is inflammation in the testicles in men, which can cause short-term or long-term infertility. So that's the reality behind that. The other thing people say is, well, it's a really rushed vaccine. It came out very quickly, right? So to understand this a little bit better, we have to understand how vaccines are actually traditionally produced for people. So traditionally, yes, it takes 5 years, a decade to create a vaccine. And that's because, there's many phases to producing a vaccine. You start with first deciding, is this vaccine creating an immune response, which is in phase 1 and phase 2. And then you go into smaller scale studies looking at, we'll give this out to a small group of people, then a big group of people, and then we send it to the FDA, and then the FDA spends 5-6 years reviewing all of the data. Then we manufacture the vaccine. Because COVID-19 is such a big global issue, we changed the way we do this. So we changed this in a few ways. One is that we started combining some of these processes together. So instead of we send this vaccine out to 20,000 people and then we get FDA to afterwards look at the data and spend 2 years with it, we started doing both at the same time. So while they were doing the studies, FDA at the same time was reviewing all of the data. So we started crunching these issues into overlapping timelines. And then once we figured out that the vaccine was actually effective, we started manufacturing it at the same time. So one of the things that was changed in terms of the legislation was that for Pfizer, Moderna, all of these different pharmaceutical companies, the government said, regardless of what your vaccine is going to look like, we will buy your vaccine. So they assured them that we're going to buy this vaccine. So because of that, they actually started manufacturing while they were doing all of this review process at the same time. Now, yes, the one thing that is different here is that we are still trying to figure out, when vaccines come out on the market, it's been known to be researched for many years. So sometimes we have bigger safety data over the course of several years, right? And so that is a legitimate concern that people have. But one of the things that I want to point out is that when this vaccine actually comes out, there is 2 months where we actually accumulate safety data. And because COVID-19 is so prevalent, we had very quickly, we were able to get 30,000 people involved in these studies. In other studies, it takes a long time to recruit and enroll people, but people were very excited to give their arm for a vaccine. So very quickly, we had big numbers. And so we monitored these people for 6-8 months in order to get safety data. So that is one good thing. mRNA is also not a new technology. We've been having mRNA technology for the last 30 years. It's our first mRNA vaccine, but this technology is not new. So that's the other thing that I want to make very, very clear. If you have had COVID-19, you should still get the vaccine. When we look at the studies looking at your body's response to the actual vaccine, the response your body creates to the vaccine is actually a much stronger response than the response your body creates when you just have COVID-19. So you probably are better protected getting the vaccine than if you had COVID-19. And we actually also don't know how long your immunity actually lasts after getting COVID-19. So for this reason, we do recommend that you still get the vaccine, even if you've already had the virus. So this is a controversial part here. Right now, the statement I'll make is that if you get the vaccine, you should continue making an effort, wearing the mask, making sure that you wash your hands, doing all of these things that you normally do, because getting one shot doesn't mean that you're immediately immune. It takes time for your body to create an immune response. And we also don't know if you can still spread the virus even after getting the vaccine. You might not have symptoms, but we don't know if you might be a carrier that's able to spread this virus. So until we have that data, and until we get overall numbers low, we still recommend that you continue wearing your mask. Ultimately, so this is a really good post that I saw on Twitter. If it comes down purely to numbers, 26 million Americans had COVID-19 in the last year. 420,000 of them died from COVID. Up to now, 29 million Americans have gotten the COVID vaccine, and 0 people have died from COVID-19 among people that have had the vaccine. Yes, some people have had COVID after getting the vaccine because it takes 2 doses and time for you to build the immune response, but nobody has died. So vaccines are safe. I trust it. I got both my vaccines, so I'm fully immunized now. And when it's your turn, I suggest that you get it as well, okay? So I'm done my presentation, but I'm happy to take questions after Manish Uncle's done speaking as well.
Thank you, Dr. Gabri, for your presentation. It was very informative. Next, I would like to invite Mr. Manish Patel with his presentation.
So thank you, Dr. Gabriel, for a wonderful presentation. For giving us an insight on what the viruses are and how it impacts the population, and about the vaccine part of it. First of all, I want to thank the Niagara Malayali Association for giving me this opportunity to speak on behalf of the association. Now, I'll touch base on some of the very preventive aspects of the COVID-19. And as we all know, like we all know about the facts, what is working and what is not. So I'm not going to go into details, but I just want to support it by discussing the science behind it. So how COVID-19 is spread. So if there's an infected person, if there's an infected person near you, and if the social distancing is not maintained, the infected person would spread the respiratory droplets, and that's how the COVID is spread. That's one way of spreading it. Sometimes there are aerosols created when you cough, when you sneeze, when you sing, when you shout, and when you talk. So that's why we are maintaining the physical distancing, which we are maintaining. Aerosol in terms of they are the airborne particles which are generated in the air, which settles, which takes time to settle as compared to the respiratory droplets. So that's why we are saying to aerate the space more if we are in a closed space when we are talking to each other, or we should always maintain social distancing. When a person touches another person, so that's why we are not handshaking right now. We are not hugging our loved ones also. And that's one of the bad part about it, is like we are not able to hug the person whom we love. But that's the naturality of the virus. So we have to all do whatever is required to prevent the spread. The infectious droplet or aerosol may come in direct contact with the mucous membranes. So that's why we protect our mucous membranes, especially the eyes, the nose, the mouth, and they may be inhaled into the eyes, mouth, and airways, and that can start the multiplication of the viruses inside your body. And when a viral load leaches to an extent, then an infection is being seen, and then the test can come back positive. So I'll explain you something about what quarantine means and what to isolate means. So if you have no symptoms and you are returning from a travel, say I visited India back home, and then I come to Canada. If I visited and then I come back without any symptoms, I have to quarantine, and the quarantine is for 14 days. And if you are traveling to any of the provinces that enforces like 14-day quarantine, or any of the countries, so in that case, we would take an example of US. So if you are visiting US and coming back to our country, the law says that you have to be quarantined for 14 days, no matter what your symptoms are. So in that case, you are not symptomatic, then also you have to quarantine for 14 days. If you have a close contact with somebody who has or is suspected to have COVID, so say, for example, one of your family members or one of your colleagues, if they have identified to have symptoms of COVID, and if you have close contact with them, then you are to quarantine for 14 days as per the public health. You have been told by the public health authority that you may have been exposed to COVID-19 and need to quarantine. So some of the cases, like if the public health usually does the community part of the tracing, contact tracing, and if they figure out that while they're contact tracing, if you are the one individual who needs to be quarantined for 14 days, they have like categories like high risk as well as the low risk. So in that case, they will identify you as a contact exposed based on what your risk is, like is it a high risk exposure or a low risk exposure? And they have definitions to fulfill those criteria, and then they designate that whether you are a high risk contact or a low risk contact. And based on that, if they ask you to quarantine, that's 14 days. So that's all about the quarantine. Like what does to isolate means? So say if I am diagnosed with COVID-19, then I have to isolate for 14 days. You are waiting for your results. A swab is being taken, and then you're asked to isolate yourself until the swab results comes back. Then you have to isolate yourself until the swab results comes back. Symptoms of COVID, even if you have mild symptoms and you have been in contact with someone who has or who is suspected of COVID, then you go ahead and isolate yourself. And as I mentioned previously, if you're told by public health, then you do the same. Return from a travel outside Canada with symptoms of COVID, then there would be a mandatory isolation as well. So some of the key features when you want to prevent COVID, the use of, basically for a layman, it's the use of the non-medical mask. And 3-ply mask is always preferable. However, 2-ply also can work. But studies, like laboratory studies, have shown that 3-ply mask is enough for a layman. If you're going for a community grocery shop and if you're wearing a 3-ply mask, you are at the lowest risk of getting COVID. When you are in public and you might come in close contact with other people, then you have to wear the mask, as well as you have to wear the mask when in shared indoor spaces with people from outside your immediate household. So it's better. So if you have invited somebody to your house and if you don't know the status of that person, it's always advisable to wear the 3-ply mask. And non-medical masks, the ones which are non-disposables, you can clean it, however, every day or whatever permits you. The other thing is to maintain the social distancing. It's 2 meters, and the rationale behind the 2 meters is because when you expectorate something from your mouth to the community, the droplet which travels in the air won't far travel after 2 meters. So there are scientific evidence saying that if you cough or if you sneeze to other person, then the maximum the droplet which will travel in air would be 2 meters, and after that it settled down on the surfaces. So that's why we say to maintain the social distance for 2 meters from each other. Now, if a household contact don't need to distance from each other, because it's called a bubble. So you are in a bubble. So if your family members, if you have one son and one daughter and you're living with your wife, then you are in the same bubble. So there you don't physically distance, but on the other end, you just take care of if there's any symptomatic case or anyone of your loved ones amongst your family, if they get any symptoms, then you have to make sure that you follow whatever is required to follow. The other thing I would like to bring here up is to avoid the closed spaces and crowded places. So just not too many people gathering at one single home or in one single premises. Better to maintain the social distancing and keep the number of people you have prolonged contact with as small as possible. That will help you to prevent COVID getting to you. The other, right now, I mean, there's a culture of us working from home. And currently, as we are in the state of emergency in Ontario, people have started working from home, which is safe. So that will make them safe as far as the COVID is concerned, and away from others if you feel sick. So if you feel sick, stay in a home in one quiet room and then do whatever is required to be done every day. Just have less contact with the people, wear your mask accordingly, and when you stay home if you are feeling sick. Limit the contacts with those at high risk. So say if my loved ones, like my elderly parents or some of the close family friends are in a long-term care, I would avoid those contacts. Or if I have, say, a medical condition person who is elderly, and if they have any medical conditions or any immune system compromise, as was discussed by Dr. Gabriel, then we need to limit the contacts with those people, because those people are more prone to get the COVID-19. The other thing which would help the community in bringing the rates down and the hospitalization in Ontario, especially at this point down, would be the flu vaccines. I would encourage each and every one of you to get the flu shots, which will not protect you against the COVID, but it will protect the community in reducing the burden to the Canadian healthcare system during this pandemic. The other routine measures, as we all know, would be to wash your hands often with soap and warm water for at least 20 seconds. And that will get rid of all the organisms, so microorganisms which are on your skin. Sometimes you can, if you don't have like a soap and water, then you can use your hand sanitizers. But just make sure there are many hand sanitizers coming in the market with not appropriate concentration of alcohol. So it should be at least like 60% of alcohol in it. So just read the labels and get whatever is required. So the least minimum concentration of alcohol required is 60%. While coughing and sneezing, just make sure that you cough and sneeze in your sleeve. So that way the droplets which are generated when you cough or sneeze, they are not in the air, and that way you can take care of the other people around you. Avoid touching your eyes, nose, and mouth with unwashed hands. This COVID has brought us to a point where we all are vigilant on cleaning our hands too many times a day. And that's good, because there are studies done that unintentionally in one single minute, I guess it's 10 or 12 times you touch your face. And that's how the virus reaches to a site where they can start multiplying there. And they can proliferate, and they can multiply, and they can get the environment what they need for them to cause an infection. Some touch points on the disinfectant to be used and all the high touch surfaces like toilets, phone, your doorbells, your doorknobs, everything needs to be cleaned twice daily, if not like once, because you never know like who is coming to your house and they are touching those surfaces. So it's like cleaning and touching of those high touch surfaces with the disinfectant wipes. There are many wipes available in the market, and they all are like Health Canada approved, so they are safe to use. Wondering if people know about in the Niagara region, we have like the Niagara Health Assessment Centers, and there's a link provided. So I guess the presentation would be shared with you guys. So you can go to the link. You can book the appointments online as well as you can call them for an appointment. You call the given number there and you call the extension there, and they'll call you back and schedule an appointment with whoever needs a test. And then in 2020 had a lot of things we have to learn from that. Don't give up trying to be heard. Just put your message out there, supported by some science there. So that way it is an evidence-based message, which you say. Don't too much look at the social media, especially when it's like you don't know and you're confused. Just take support of some of the scientific evidence which is there out in the market. There are a lot of resources on Public Health Ontario website for the COVID-19, and there are community, there are resources for the people, there are resources for the healthcare workers who are working. I would just update myself going to those resources rather than going on the social media and panicking yourself about what it is. So go through those documents. So we have learned a hard way to make sure that we prevent COVID from attacking our loved ones as well as us. Now, what do we hope for in 2021? We will find the balance needed in order to reach the consensus as a community and in our lives to move forward together, and we all can defeat this virus moving forward together and supported by the scientific evidence. I would like to thank you very much for giving me an opportunity for the presentation.
Thank you, Mr. Manish, for your presentation. It was very informative. So now we will take on any questions you might have. Please feel free to ask the presenters with any relevant questions.
Hello, Dr. Gabri, this is Anil. I just want to ask a couple of questions, if I may. First is the duration of one dose to the second. Usually it is scheduled, I don't know, I think a couple of weeks. Now, for an example, if somebody has taken a vaccine and the second dosage is not available, how long is it good? The first dose is good until we can take. Now, let's say if the second dosage is not received in time, do we have to take 2 doses? That's my first question. Can I ask a couple of questions together, or should I wait for this answer?
So you can ask a couple of questions if you like. I'm
Okay.
happy to bulk response.
Okay, then the second one is when it comes to vaccinations, do we have an options to opt for one company's, let's say Pfizer to Moderna, or let's say if I want to wait for the single dose Johnson & Johnson? That's the second question. And the final question is, you often hear about herd immunity. Now, the herd immunity is the herd immunity is obtained when a community is vaccinated, let's say more than 60%, or how do you say that? I just want to get some information on that. That's all. That's all I have to ask. Thank you.
Yeah, for sure. So with regards to the first question about delay, so you're right. So with the supply chain issues, we are seeing a lot of healthcare workers and people who have gotten the first vaccine being told that they can't get the second vaccine, like they booked the appointment, but it got canceled. So the CDC has released some recommendations on this. According to the CDC, you can safely get the second dose about 42 days after the first for both the Moderna and the Pfizer. That's recommendation I've seen from the CDC. Now, if it's gone past the 42 days, that part, it's not clear to me. You may need to get restarted on your vaccine schedule. But that part I'm actually not sure about. So you'd have to basically, in that situation, get the guidance of a public health doctor beyond that. But I know that if you've been delayed from the 3 weeks or the 4 weeks, 42 days is what I've seen CDC recommend. And so with regards to your second question in terms of choosing between one vaccine versus the other, so that part also comes down to the guidelines set out by public health and what they allow or not allow. Right now, there's not really an opportunity for much choice, because it's more of a supply chain issue. When you're a healthcare worker and they tell you, it's time for you to get a vaccine, you don't really get much of a choice in terms of what kind of vaccine you get. It's what's available to you. Johnson & Johnson and AstraZeneca hasn't yet approved in Canada. Once we get more and more vaccines and there's more of a distribution program for the rest of the community, maybe there will be a choice, but right now there's not much choice this early. And then with regards to herd immunity, so the number that I've seen quoted, so I don't know, Manish Uncle or Manoj Uncle, if you guys want to jump in on this number, I've heard is actually 60 to 70%. Some resources I've seen say 60%, some resources say 70%. The whole idea behind herd immunity is that if we use the example of the 29 people that are within the Zoom chat, if 27 of the people, or if all of us were, say, outdoors at a party, right? We were at a Malayali get together at a picnic. If 27 of us had the vaccine or had immunity to COVID-19, then there's less of a likelihood that in all of our interaction, that the two people who don't have the immunity or don't have access to the vaccine will actually acquire COVID-19. Because they're protected by the immunity of all of us around them. And so that's the whole idea of herd immunity. You're protected by people around you. So when we say a number of 60 or 70% of a population, we're saying that that's the threshold where we start seeing effect of other people protecting each other based off of their immunity to a virus. And that's the idea behind it. Yeah. Hope that answers your questions.
Yeah, thank you. Thank you very much.
Yeah.
So let me take another question from the chat box. So there is this question, how does the COVID Alert app work?
It's I'll take it. I mean, the COVID Alert app is meant for, I guess, public health. I don't have much idea about it, but when I was back home and when public health sent us an email while we were coming back, I think that's when they sent you the link to the COVID Alert app, and you have to register for that. And then I guess what it does is it tracks the positive ones around yourself. So if, say, you have registered for the app and I have registered for the app, and if I have provided all the informations required, then I guess that would be helpful in terms of you being in a crowd and knowing that who people are infected. I don't know whether that is the whole purpose of the app, but it's kind of getting more information, getting all the people using the app and knowing more about who is positive or who is negative around you. Am I wrong, Dr. Gabriel?
No, you're right. So a couple of things that just about the app that's I think people get really worried about government apps because sometimes people are worried that their privacy data is going to be taken or Now the government knows what I'm looking at, or all of these other things. So anytime there's an app available to you on your phone, you accept a terms of agreement in terms of what are the things that you're releasing in terms of your data to this app, right? So when you actually, so the government of Canada, when you go on their website, they do have a website page that's dedicated to what kind of information is actually taken from this app. So this app basically doesn't take any information from what we call cookies, which is in terms of the kinds of websites you visit or your social media. It doesn't take any of that information. It's purely using Bluetooth. So it's basically exactly like Manish Uncle said. It's, you know, if I have COVID, I go on this app and I say I tested positive. So the app will now ping that I am now positive. So anytime I'm around someone and their Bluetooth signal connects to mine and recognizes that we're near each other, it'll transfer that information that I'm positive to the other person's phone. So that way the other person's phone now detects I've been in Bluetooth proximity to someone else that's positive for COVID-19. So it's based off of Bluetooth technology. It's not taking your information and putting it out into the cloud or anything like that. So government's not like stealing your data.
It's more of a transparency thing, and it's more of for the use of the community. So I think it's always better to enroll for the app, but that depends on person to person.
Thank you, Dr. Gabriel and Manish. Does anybody else have any question now? There is one question from the chat box that how has COVID affected one's mental health? So I think it's a question for Manoj, I guess. Manoj, can you unmute your mic, please? Thank you. Okay.
So that's a very good question. So over the period of time, as I mentioned earlier, people have very good, in Canada, people have always feeling that they are much better positioned than most of the population in the world. And especially the immigrant community, and they feel that they are quite settled here, they are good. But since the COVID started, it affected their finance. It's affected their any chance for relaxation or unwinding their emotions and stress, and they could not have access to their normal services like a mental psychiatrist or counseling centers, and the children are stuck at home, and most of the families feel that they have no opportunity to socialize. And as a human beings, we always feel to socialize, and we are stuck now, homebound all the time. And then the interaction takes place between just the household members. And of course, the stress among the family, especially in terms of finance, job security, and trying to contact with their families or other people, have increased their stress level in manifold. So naturally, it affects their emotional and mental health, and that leads to increasing their anxiety and leading to depression. And in order to cope with the increased stress and anxiety, they use unhealthy coping mechanism like drugs and alcohol. And that is the very reason we notice that the use of alcohol and drugs have significantly increased since the outbreak started. And unfortunately, we have very limited service in our area for mental health, and that is further shrinked due to COVID. and that also limits our community to access those services. I hope I answered the question.
Thank you, Mr. Manoj. Any other questions? So there is another question. So the question is, does having one drink daily help prevent the COVID?
Dr. Gabriel, do you want to jump in, or do you?
I don't. I don't know, but I will say, I mean, it might help maybe your mental health initially a little bit, but I don't know if it's necessarily going to prevent you from getting the virus, unfortunately.
Okay, so at the best of our knowledge, there is no scientific study to establish that alcohol drinking helps to reduce the spread of COVID-19. But of course, having daily drink in the sense, what is the volume or how much you are using, and then again, if you are using seven drink per week, then it's okay, not for reducing the spread of COVID-19, but just for maybe for health reasons. But if you are increasing your drink more than 12 to 14 drinks per week, that shows that you are emotionally not in a good condition. So that is almost leading to alcohol addiction. So in that case, again, that we may have to seek out addiction support. And there is unfortunately there is no scientific information or a study about use of alcohol and reducing the spread of COVID-19.
Okay. Thank you. Okay. Do you have a question, Bob?
Yes.
Yeah.
My question is for Gabri. So we know that earlier the first version of COVID-19 came, and now there's a variant of COVID-19. So my question is, how much more should we be worried about the new variant of COVID? Like, is it the same concern that we should have, or that is like more dangerous and we should be more worried about the new variant? That's my question.
Yeah, that's an excellent question. So it's on everyone's mind is this question about new variants and all of that. The reality is there's nothing. This is what viruses do, right? All viruses mutate with time. So this is one of the reasons why every year we have to get a new flu vaccine, right? Because the flu vaccine, like the flu changes every year. Now, this is expected with COVID-19. We've had responses from countries where, like Brazil, like the United States, where for a long period of time the virus was very, very rampant, and so every time the virus enters a new person, that's an opportunity for the virus to change in some way, and so it's possible that we do have viruses. The virus has now created variations that might make it more easily transmissible. Certainly, the studies might suggest that it is in fact more transmissible. Whether or not the new variants are more deadly or not, that I haven't actually come across any convincing literature to suggest that it's in fact more deadly. Although by virtue of being more transmissible, that can make it more deadly, right? So if 200 people get COVID-19 instead of 100 people getting COVID-19, then you've doubled the chance of death from COVID-19, right? So that in and of itself, from a population level, could mean more people die from COVID-19. Now, from an individual level, what does this actually mean for you or I? Doesn't mean that we change anything in terms of what we're doing, right? We still continue to do the same things, social distancing, wearing a mask. We get the vaccine. The vaccine is probably the best and most important tool and weapon that we have against this, because it lets us put a stop to this, right? And as far as we know right now, the vaccines seem to be effective. I know there was some question about Moderna and the South African strain. The reality is that the threshold in terms of the protection right now, we still feel that there is protection. You know, it's not a are you protected or are you not protected? It's a spectrum, right, of the degree of protection. Sure, maybe it might not be 95% with the new variations. We don't know. I know that Moderna says that they're going to be looking into it and they may come out with a booster later for these new variants. But from the individual level, it doesn't change what we do, right? And this is so important because whatever we do here in Canada, if the United States isn't doing their part, or if Brazil is not doing their part, we're still going to continue seeing these new variations. So it really does highlight how much of a global issue COVID-19 is. I know that, I don't want to get into the politics of it, but, the global north has a lot more vaccines than the global south, right? And so I personally worry about how some of these countries that don't have access to the vaccines not being able to fight off this virus and maybe getting outbreaks there, how that's actually going to impact everyone else, because we do live in a very globalized society, right? So it's complicated. I mean, the reality is there's a lot of data we don't know, but what we do as an individual doesn't change necessarily in all of this. That's my thoughts.
Hi, Dr. Gabri. It's a connection to Bob's question. I heard that the new variant is a risk for the children. Is there anything fact in that?
That's a good question. I don't know, to be honest. So I don't know. I haven't seen the data around it being necessarily more deadly for children. COVID-19 in general impacts children. We know that there's less mortality and kids tend to get less sick, but there are kids that also do get quite sick from the virus. But I don't have the answer, unfortunately. I haven't really seen the data to say that it's more dangerous for children. I don't know if Manish Uncle or Manoj Uncle, if you guys have any information on that.
No idea.
Thank you.
Thank you. So there is this another question related to mental health. The question is, how can I monitor my mental health? There's two parts for this question. So the first part is, how can I monitor my mental health? And what are the concerning issues?
Sorry, Millie, can you say once again?
Sure. First part is, how can I monitor my mental health? And second part is, what are the concerning issues?
Okay. One is in normal situations, we are able to how we enjoy first we need to understand what is our baseline, how we function, how we are doing, and what if there is any variation from my baseline. That's what we need to understand. And of course, the mental health is always about observation. And most of the situation, what happens, the person who experiences any difference may not be able to realize that the person is undergoing any differences, any variation from his baseline. So most of the time, the nearest one, like a spouse or a family member, or their immediate friends, would be able to identify what kind of change is happening in that person. And of course, then referring the person to the mental health unit or mental health services, or to refer the person to regional public health for the COVID assessment, or for community emergency services like a COST or a safe bed, or any of those emergency services for further assessment. And then, of course, if there is any further delay, please feel free to contact their family physician for appropriate guidance. And also, I would encourage the person to contact either public health or accessing cost emergency service line. And then the next one, how to access the services. Again, through the, we may have to go, there is no shortcut to access those services. In the Niagara region, we have a couple of options. One is through family doctors. We can access centralized access psychiatric emergency service, which is based in a St. Catherine site. And also we have satellite sites in GNG, and just recently opened the program called CAPS, and that one is available in Welland Hospital as well. And we don't need to go to the hospital for that one. It is most of the assessments are over television or on computer or even provided over the phone. So qualified psychiatrists from St. Catherine's Hospital or nurse practitioners working in this field would be doing the prime baseline assessment, and further assessment required, then social workers or further support mental health nurse would follow up on that one, and then they will make the appropriate referral to public health or refer them to emergency services or to get admitted to psychiatric unit or to refer to outpatient programs in the hospital. Thank you.
Thank you. I would like to add to what Mr. Manoj explained. You can go to the website of ontario.ca and search for mental health services, and you will find more than 400 agencies across Ontario that will provide mental health support. So there is this another question. For someone who has been positive previously, what are the effects of getting the vaccine?
I can take this answer. So there shouldn't be any issues if you've tested positive previously. I mean, the only recommendation I've seen through the CDC on this issue has been if you've gotten treatment with monoclonal antibodies, which is an in-hospital treatment that some people with COVID-19 get. They recommend waiting maybe 90 days before getting the vaccine. Primarily because it might decrease the effectiveness of the vaccine if you've had the monoclonal antibodies. But other than that, getting the vaccine after you've had COVID-19 is in fact recommended. And it shouldn't have an impact in terms of causing you to get sick or get any disease. Again, the vaccine is not COVID-19. It's not like, many people when they think of vaccines, they're thinking back to like polio or varicella, where they're giving kind of a weakened version of the virus to try and stimulate an immune response. That's not how these vaccines are working. These vaccines are just telling your body to detect one small piece of the virus on top of the virus's cell. So all it'll do is tell your body how to battle that and battle it a little better than just the virus infection alone. So there shouldn't be any issues.
Thank you. And the another question is for Dr. Gabriel. So how long does the effectiveness of the current vaccine last once I take both doses? And he's hearing different durations of effectiveness. So
yeah, this is a good question. The true answer to this is that we don't really know. So this is part of the issue with the fact that we're still actively monitoring this vaccine, right? We're monitoring to see how long the effectiveness actually lasts. Like, we've only had the vaccine being monitored for less than a year. So it's certainly possible that a year later, maybe some of your immunity declines. It's possible that you continue with it as well. Whether this will actually impact you getting COVID in the future really depends on what happens to this virus a year from now. Right now we're in a pandemic. The question becomes, does this turn into an endemic virus? Endemic meaning that this is something that exists within our population each and every year. Now, it doesn't mean that it's going to necessarily exist within our population as severe as it is right now. It might mutate once, I mean, many viruses, once you have enough herd immunity, sometimes gets weaker over time. It might evolve and become like a weaker version of like the cold, and it might be there all year, every year. Sometimes it might go away. We don't know these things yet. So there's sort of two parts to your question. One is, I guess what I'll say is, do we know how long immunity is going to last? Probably not yet. Does it matter? It's also to be determined. It depends on what happens to the virus. That's my thoughts on it.
Thank you. So Mr. Manoj has shared the crisis line called the Coast Crisis Line, who are available 24/7. And their number is 1-866-550-5205. So just in case if anyone need any mental health support, they are 24/7. I can repeat the number. It's 1-866-550-5205. Thanks. Any other questions?
There's a question about vaccine and immune system, compromised immune system.
Yes. Yeah, good.
Yeah, I'll just really quickly talk about that. So again, in the studies that looked at this, they didn't include people with severe immune disorders. The reality is, compromised immune system is a big term, right? If you have diabetes, you have a compromised immune system. And that can go all the way till, you're on chemotherapy and your immune system is very, very compromised. So you kind of have to make this decision with your physician, have a conversation depending on your own risks. The reality is, the main concerns that we have in people that have compromised immune systems is about the vaccine's effectiveness more than anything else. Sometimes you might be concerned, like, I have an autoimmune disorder. Will my immune system cause any issues that causes me to hurt myself by creating some antibodies, all of these other things? This is all on a case-to-case basis. You'd have to really talk with your physician if you were that complicated in terms of your medical history. But for the average person who's immunocompromised, it's a decision you can make for yourself. Just knowing that people with your disease characteristics were excluded from the trials, but it is reasonable for you to get it. I mean, a lot of people I know, some of my patients with immune disorders, also some of my friends with immune disorders have gotten the vaccine or are planning to get the vaccine, just understanding that the risks and benefits. Yeah.
Thank you. Does anyone have any other questions?
Okay, great. So, Millie, let me take over now.
Okay, sure.
Okay, great. So I just want to say big thanks to Dr. Gabriel, who expressed great interest and vigor in supporting our community and sharing his wealth in terms of his knowledge. And that's very, very highly appreciated. I know that Dr. Gabriel is so busy and he is just due to go back to his work now, I think in a very short period of time. In fact, he's a busy work schedule, and being an emergency physician, we know that one very hectic job, and in spite of his schedule, he was very willing to support us. And once again, thank you very much, Dr. Gabriel. And also just want to say a big word of thanks to Manish, my friend. We work together in hospital and we very often discuss about COVID and other issues related to health very often. And when I checked with Manish about his sharing his knowledge, resource with us, and he, without any hesitation, he volunteered to support us, of course, and we really extend our grateful thanks to Manish. Thank you so much, Manish. And Also next to Millie, and Millie, you did a wonderful moderating role, and also Laiju for providing us with all the technical support. So thanks to both Millie and Laiju. Thank you so much. Lastly, all the people who attended and supported, especially Simon, who provided the basic information about the contact information about the baby, and all those who have participated. And I'm pretty sure that we have so many questions to ask, and most of the time we have provided the right answers, provided the information. And in case if you have any other questions or anything, please feel free to contact us, any one of us. We'll be happy to take that one back to you. Thank you very much for your wonderful participation and greatly appreciate it. Thank you so much.
Thank you. And I would like to thank NMA for organizing such a great event. And thank you, everybody, and have a good night.